for the kind words of introduction. Actually, me and Bansi have swapped talks because I have another talk in another hall at the same time. And you might have come here to listen to Imiglimin and you land up, this is a promotional talk sponsored by Novo Nordisk of Ozempic. So you might see that word Ozempic somewhere, but it's nothing but semaglutide 0.25, 0.5 and 1 milligram. And it's titled as Epic Legacy and Epic Outcomes. And it's now available in India. So that is my duality and conflict of interest for this talk. I also have other disclosures which are put up here. And my acknowledgement and gratitude to Diabetes India and Bansi Sabu for allowing me to be here. And as I told you that this is a Novo Spark in their educational program. We all recognize that there is a multifactorial reality that diabetes and weight issues are simultaneously occurring, because diabetes is not an isolated disease. And I think last couple of days and the entire last 2-3 years you have been hearing this. It's inflammation, weight gain, hypertension, adiposity, insulin resistance. We were having a very nice talk by Dr. Taheri just before this. So clearly all these factors are important risk factors for end organ damage. And therefore the current diabetes management is not just isolated to diabetes management alone, it's diabetes and weight. And it's a holistic, multifactorial, person-centric approach. And therefore now we have, though it's quite late, a global molecule, now local, which is semaglutide. As I told you, it's titled Ozempic because we have Wegovy, which is also having same strengths but also go up to 1.7 and 2.4. Almost 7.5 million people use this molecule. It's approved in 75 countries. It's the most prescribed GLP-1 agent across the world, and now it's available in India. So that's something which we recognize very clearly. In fact, there have been babies who are named as Ozempic babies. A couple of, in my previous talk on Thursday evening, I said, we had the millennials, we had the Gen Zs. This generation is going to be the GLP-1 generation. So clearly, it's competing. The GLP-1 agents, including Ozempic, are competing to be the optimal first-line therapy because they are causing a very durable and sustained glycemic control, compelling weight loss, weekly, once a day, once a week dosing, and have a cardio-renal impact. So clearly that's very much there. And it's approved for first-line use in diabetes in India, in adults with type 2 diabetes. As I said, Wegovy is restricted for its use in obesity. And the reason I'm using the trade names is because currently they are still under patent. I'm told that in due course they may be off patent. So it's clearly an adjunct to diet and exercise. And also it has an additional label indication to reduce MACE in cardiovascular disease and to reduce the risk of sustained EFR decline and ESRD and cardiovascular death in the CKD population. So there is a renal and cardiac advantage, and which is pretty compelling. There is also a MASH advantage. So clearly, if you see the clinical development program of this molecule, there have been large trials, and some of those trials have engaged a significant population, like the SUSTAIN program. We have the SUSTAIN IP, the SUSTAIN 1, the SUSTAIN IP add-on, the SUSTAIN China, the SUSTAIN 4, the SUSTAIN 8 and 2, Optimize, and so on and so forth. But SUSTAIN program and the FLOW program, there are more than 20,000 population with 17 trials. It's a very, very evidence-based molecule and has some cutting-edge compelling data. When it comes to the glucose component of it, because the approval of this agent for diabetes, it's one of the most potent A1C drops, and you can see that the A1C drops to 2.8 with a higher baseline A1C level. And 4 out of 5 people who take semaglutide up to 1 milligram, they will have a A1C below 7%. So almost 80% coverage, which is something recognizable. They reduce body weight up to 8 kilograms with people living with diabetes. In the Indian population with a higher BMI, we have seen a little more fat loss and weight loss both. And 2 out of 3 people achieve a clinically meaningful weight loss with reduced waist circumference. Clearly, the A1C reduction is not only robust, but the weight loss and A1C both. And there is head-to-head data versus SGLT2, versus insulin, versus gliptins, and versus other GLP-1 receptor agents, and also versus placebo. So clearly that data, when it comes to the evidence base, probably the semaglutide 1 milligram or Ozempic is one of the most well-studied molecules in the diabetes space on planet Earth. So clearly it is endorsed by ADA as a very high efficacy drug, both for glucose lowering and weight lowering effect. So if you look at the current ADA recommendation of 2026, clearly on the compelling hierarchy, it has a very high rank with high efficacy. It's a very high efficacy agent. And if you look at Sustain 6 as a trial, which is a cardiovascular outcome trial, you can clearly see that it's a randomized control trial with 0.5 and 1 of the semaglutide versus placebo, and it's randomized double-blind placebo-controlled trials. 83% of the population had established cardiovascular disease, CKD, or both. And clearly you can see a significant 26% reduction of MACE. So when it comes to cardiovascular outcomes, a very early separation of curves and a hazard ratio of 0.74. So very clearly, that's the reason probably these molecules have become extremely popular in commonplace because of the compelling data. And as endocrinologists and diabetologists, we should not forget that as much they are popular in the weight loss arena, they are having very, very compelling data even in the glucose arena. So clearly when it comes to cardiometabolic risk parameters, it's almost a 12% reduction in free fatty acids, 14% reduction in triglycerides, a 12% reduction in the serum VLDL, and an 8% drop in the LDL parameters. So clearly a lipid modulating agent. What is more compelling with this agent is the kidney data. So up till now we always had SGLT2 inhibitors as standard of care. After the EMPIRE trial in 2015, which was a game changer trial, we always felt that SGLT2 inhibitors are here to stay. They protect the kidneys, they protect the heart, but probably now semaglutide, Ozempic data has pipped them. Because we have robust weight loss, which SGLT2 inhibitors don't have, and robust cardiac outcomes, renal outcomes, peripheral vascular disease outcomes, obesity outcomes, as well as MASH outcomes. And that data is very, very compelling. And clearly if you look at adults with CKD and type 2 diabetes, in 28 countries, 387 sites, the flow data clearly had a primary composite outcome of more than 50% reduction in EGFR, kidney failure, CV death, and death from kidney failure, and secondary outcomes, which is the annual rate of change of EGFR, major MACE, and death from any cause. So 24%, that magic number 24% comes back, lower risk of composite kidney outcomes. Hazard ratio of 0.76. So hazard ratio of 0.74 for cardiovascular reduction and hazard ratio of 0.76 for renal reduction. So very, very compelling data again, which is seen with this molecule. It is 65% slower loss of kidney function. It delays kidney failure up to 5 years. So clearly there is a proven risk reduction of kidney events with 1 milligram of semaglutide. Very established safety profile, 38 billion person years with proven safety. Of course, we know we start low and go slow. They do have GI intolerance as issue with mild to moderate. We should be mindful if there's severe gastroparesis, gallstones, biliary cholelithiasis, acute pancreatitis, chronic pancreatitis, multiple endocrine neoplasia, or medullary thyroid cancer, one has to be extremely cautious using these agents. So we need to recognize that, except barring that, we have a very well tolerated agent. The dosing is very simple. Start with 0.25 milligram weekly. As I told you, this is a promotional talk because of the launch of Ozempic for just a couple of months back. And start with 0.25 weekly for 4 weeks. Then step it up to 0.5 milligram weekly for 4 weeks. And then stay at 1 milligram weekly for additional glucose control. Now, why do you prefer? Because you know that Ozempic will be competing with a lot of generics now. It is quality, purity, consistency, and cold chain. Because you know that it's a rDNA compound and it has a peptide component. We know that this is a technology platform from the Saccharomyces, and Novo has mastered that platform. It has extraordinary data on RCT and real-world evidence. It has long-term CV outcome trials, long-term renal outcome trials, peripheral artery disease trials, regulatory approval in 75 plus countries, millions of patients taking it, and a very consistent cold chain. However, the synthetic versions don't have any clinical data in public domain as of now. Neither do have any documentation in the cardiovascular outcome, renal outcome, PAD outcome, regulatory process in place still, though some of them may have limited approvals. And obviously, there would be a cold chain issue, but of course, they may bypass that because it's a peptide biology. What is it in for our patients? Because at the end of the day, we are here for people living with diabetes. Clearly, it has a 8 kilogram weight loss in the global data from the sustained group. It is up to 3% drop in A1C from the sustained group. It has the MACE outcome up to 26% from the sustained 6 data. So that data is very, very compelling. If you look at the walking distance for peripheral artery disease, the 13% improvement in that group. Kidney outcomes improve by around 24% from the flow data. The all-cause mortality comes down by 20% from the flow data. And clearly the peripheral artery disease outcomes come down by 13%. So the weight loss, glucose control, MACE outcomes, kidney outcomes, all-cause mortality, peripheral artery disease outcomes, clearly compelling, consistent data over a period of time. So this is a disease-modifying agent. It not only lowers glucose and weight, but improves renal health, cardiovascular health, peripheral vessel health, as well as all-cause mortality. We also know it has very, very good data in the liver space and in the MASH space, and it has that approval indication also in place. Clearly, therefore, if you see, and I would be happy to answer questions because I am running a little earlier on my time, clearly the 1 milligram semaglutide, which is now available as Ozempic in India, is affordable and accessible. It's much more economical than the Wegovy component. It's convenient once a week. It has more than 7.5 million users across the globe. It's very effective for glucose control. From the ADA standpoint, very high efficacy, robust weight loss, cardio-renal risk reduction with evidence base, CKD risk reduction from evidence base, and many more data, including peripheral artery disease, MASH, and some more risk exciting data coming up. Thank you so much for a patient hearing.